Welcome to Path to Med, Episode 9. Today I'm really excited to be talking to Dr. Elaine Wilson, who's a veterinarian who did 2 years of undergrad at the University of Guelph before transferring to the Ontario Veterinary College. So thank you so much for joining me.
Thank you for having me.
So let's kind of just start at the beginning. What kind of first sparked your interest in science or even like veterinary medicine specifically?
I grew up with animals. I had pets, lots of cats. And I started riding horses when I was 12. And I decided I was going to be a vet without really knowing much about science. Like, you don't start streaming into the different sciences until high school. It was kind of an early decision that fortunately worked out school-wise. My initial plan had actually been horse vet, and then ended up getting exposure in various capacities in the small animal industry, and then a little bit in equine practice, which for various reasons I ended up going more down the small animal path. In vet school, you do a little bit of everything regardless until your final year. So that was kind of my journey to small animal medicine instead of equine.
So kind of just like a love for animals and like an interest in that.
Yes.
Yeah.
Really enjoying the challenge of science, and decided to keep horses as a hobby. So they are still very much in my life, but more so how I work with them.
Yeah. So, what's the educational path to becoming a vet, like with undergrad and then vet school, and how many years does it typically take?
So when I went through at OVC, it was a minimum of 2 years of your undergrad, and then you could start applying to vet school. And for a lot of people, so I got in after my first application. So, and then vet school is a 4-year program at OVC. So I did a total of 6 years. Not everybody will get in on their first attempt, so you can apply up to 4 times. So in many cases, people would do 3 or finish their 4-year undergrad degree. Or in some cases, they would actually finish their undergrad. Some would do their master's. One of my classmates had his Bachelor of Education before he went back to do vet school. My understanding is now it's a minimum of 3 years in your undergrad for OVC, but it really depends a lot on where you go. If you're going to some of the schools in Europe, they will take students right out of high school.
Oh, is that like the direct entry? I think I've heard of that. It's
Yep. And so those programs are usually 5 years. So if you've done some of your undergrad already before being accepted, I didn't go through it, so I don't know firsthand, but I think you would skip and start into like second or third year because they've got all of their university level basic to start. So you already have a lot of that sort of base knowledge that you move more into the animal physiology.
Yeah. What are some of the common like undergrad degrees that people pursue? Or are they kind of like, is there a huge variety?
I would say there's quite a bit of variety. I mean, I went to
Like there's not a specific one you have to do.
No, there's not a specific one. There's specific biochemistry and course requirements, but you can go through any degree as long as you get all those course requirements. But it is obviously science heavy, so most of them are science based. But I went through at Guelph, so I did animal biology, which is not offered at a lot of universities. So a lot of people will come through biology or chemistry or a general Bachelor of Science. But like I said, there are people that have done their Masters of Education. It wasn't in my class, but a few years ahead of me, there was a woman doing her residency in surgery. But she done a 15-year career as a lawyer, got her science courses, and changed careers and redirected into veterinary medicine, and then specialized after that. So it's pretty varied what you can do first.
Yeah. Is it really competitive to get into veterinary school? Like, how difficult is it?
Um, I would say fairly competitive. I don't know how many people are actually applying, or how it would compare to like a medical school application pool, but it is very restricted numbers in terms of what is ultimately
Mhm.
accepted. Like my class was 112 people, um, and that is, I don't know, half a dozen they pool from the international applicants. I think up to 10 can be from the master's collection of applicants. You can apply separately as undergrad or master's applicants. And the other thing is, like, if you're from Ontario, if you're staying in Canada, you go to Ontario. If you There are 5 vet schools in Canada, but if you want to apply to one of the other schools, you have to have lived in that region for a very
Oh,
amount of
okay.
time outside of your schooling time. You can't go to, PEI for 3 years of your undergrad, but you only stay there for your 8 month, semesters, or winter and fall semesters, come home for the summer. That doesn't count towards your sort of residency in that region. You have to be there outside of school. At least that was when I went through school. I assume there's similar requirements. I don't know if that has evolved, but there were residency requirements.
I think I read something
Yeah,
about that.
out
Yeah.
your sort of region where you lived. Um, I know quite a few people now that, because OVC is so competitive, because it is very highly ranked internationally. One of my colleagues went to Edinburgh. I've had a couple of support staff that have gone to vet school in the Caribbean. I have one who's going off to the Royal Vet College in London in the fall. So
Oh, nice.
all over the place to go to vet school.
Hmm. Because then the applicant pool in Ontario is probably huge if like that large area of people is all applying to one
Yeah,
school. So,
that would be my assumption. It's just I haven't actually looked at the numbers, but I would assume so. It was very competitive when I went.
mhm. Do you know if there's like an entrance exam or is it just kind of like a written application and stuff?
It's not specific to the vet school, at least in OVC and presumably most of the North American schools. Um, we had to write the MCAT, and then a whole application letter, but it wasn't actually like an entrance exam specific to the school.
And then after you kind of graduate, what are the job prospects kind of like after graduation? Is it difficult for new grads to get positions straight out of school? No, there's demand.
There's really high demand. It obviously varies with the economy. I think when I graduated, there were like 5 jobs to every new grad. They couldn't. There have been more layoffs in the industry recently, but again, I think that's, ebb and flow. I can't say that I've heard at any point that people couldn't get a job. There's a lot more focus on finding the right job, rather than whether you get a job. Vets are
Mhm.
very employable.
So there's not a lot of like competition within the field then.
I'm constantly hearing from practice owners, like, can't find a can't find the right fit. People aren't applying. There's always rural jobs where people are spending a year trying to find vets. Uh,
Mhm.
a bit more competition when you're looking in an urban center, but there's also way more vet clinics in an urban center. So I think it works out in the end. You're very employable. You're very prepared for the industry, and the industry needs vets, and especially the pet owning population has exploded during COVID, that
Mhm.
people can't get enough. Like, you can't. There aren't, and they're likely never will perfectly match the um, the demand.
My next kind of question was, are most vets employed by clinics or do most of them kind of run their own clinic or practice?
It's a mixed bag, to be honest. I mean, it also depends what point in your career you're at. If I would say the majority of new grads are going to go work as an associate if they're going into general practice. The odd one will buy a practice quite quickly out of school, whereas now I've been out for 15 years. Probably, I don't know exact numbers, maybe 25-30% are practice owners now. Some have gone on and specialized, or they've gone into other areas in the industry and left general practice. So it's really a mixed bag, and it's entirely open at what point you actually what point you make that transition to a practice owner, whether you ever do, or whether you start a new one or buy one. There's so many options.
Are there kind of pros and cons to both, or is it quite similar? Like, even though your workplace is different?
In terms of workload, or in terms of what? Sorry.
Yeah, kind of in terms of like workload, and like the balance. Does it kind of differ, or?
I would imagine so. I mean, I've only ever worked as an associate in different roles to date. I think the practice ownership, as somebody who hasn't owned a practice yet, it becomes like its own entity and child, and that's a workload in itself to work on the practice as opposed to working in the practice still as veterinarian. And so you're going to start shifting some of your time away from clinic hours to work on the practice, or at least it's moving in that direction where you have to designate practice management and ownership work time. I think the demands are increasingly challenging compared to where it was, 20 years ago, 40 years ago when my boss bought this practice. It was a different economy. It was different client expectations. It was a different job at that point to be a vet versus what it is now. The medical record requirements, the client communication, the expectations, the medical knowledge base in general has just exploded. So it's hugely variable, but also it's going to depend on the size of the practice and who else you have working for you, and who you can delegate to, what you can delegate. And now there's a big move within the industry as well, where we're seeing a lot of corporate practices are becoming a big part of the industry, and for a long time those weren't actually allowed within Ontario. And so a lot of the medium size and larger practices are getting purchased by these corporations, and then you don't have vets running the overhead and the overarching sort of practice and business structure of it anymore, and it's just vets working in this practice in this corporate structure. So it's a big time for transition right now within the industry while that finds its new equilibrium.
Yeah, because then like the people that are managing it might not necessarily understand a lot about like the job necessarily. I'm sure it impacts kind of like the day to day. How soon after graduating are you able to like be employed as a vet? Do you kind of have to like shadow someone first, or like assist someone, or can you kind of go immediately into it?
So at least within OVC, it's structured. So you do 3 years of coursework, and then your final year is like that supervised practice where you're shadowing in the different specialties. So OVC has a teaching hospital, so you're shadowing and doing rotations. So when you graduate, you are a fully qualified vet. And to practice on any animal. Would I go practice 15 years out now on horses with my vet degree? No, but I could have. And if I went and did enough continuing education that I felt comfortable, I could turn around now and leave small animal practice and go be a horse vet. I am licensed to do that. So once you graduate, you can start that year. And actually, in a lot of cases, once you've written your CVO licensing exam and passed all your coursework, you can start working. So usually by May, when the graduation ceremony is in June.
So you kind of graduate ready to start
Yes.
working.
Yeah.
Yeah.
There are a lot of people that will choose to go do an internship, which is a more intensive sort of clinical year at a large facility for training purposes, either because you then want to apply to a residency to become a specialist, or with certain species, like a lot of people that do choose to go to equine practice will do that intensive internship year because you are working on very high value patients, upwards of, 6-7 figure animals. You don't want to make a mistake there. So having that extra sort of intensive year as an intern, where you still have people sort of double checking over your shoulder, is just that extra sort of support and exposure to become more confident and competent as a new or recent grad.
Is that common, or is that kind of like a very small percentage of people that want to specialize?
I No, that would be pretty common. I would say a good portion of my class did decide to move into internships and residencies. It's the same. There's a match program like there is in sort of human medicine. So does everybody get a match? No, and then there's a scramble afterwards to try and get it. But I would say probably 15 or 20 of my class of 100, which I think is a pretty high number compared. Not every year is going to be that high. Went on, and a lot of them will do it right out of school. Like they'll just go from their fourth year and then apply to internship and residency. But there are instances where people will go do general practice for 3 or 4 years and then apply for their internship or their residency. And depending on the specialty, they may have sufficient clinical practice where you don't have to do the internship before the residency. So that's what a friend of mine did, who went into general practice for a few years and then decided to do an anesthesia residency. And now she's the head of the anesthesia department at a university in the States, so all kinds of options.
So you said that a lot of people that you know kind of studied abroad in the UK or the Caribbean. So is it difficult for them to come back and practice in Canada, or is it pretty straightforward?
If you go to a AVMA accredited vet school, then it is still fairly straightforward to come back. You pass your clinical exams, you write your regional licensing exam, and it's pretty straightforward, as if you were going to school here and then come get a job. You've still met all the requirements. If you end up going to a school that is not AVMA accredited, then the training program, because they haven't assessed whether it meets all of the practice requirements, you will have to do what's called a V-step program, which is more of a clinical proficiency exam. So you have written and practical exams on your surgical and practice skills. To my knowledge, most of the European schools and Caribbean schools have their AVMA accreditation, but that's certainly something you would want to double check before applying if you plan to come back to Canada and Ontario in general.
You kind of mentioned a few of these, but what are some of the different settings that vets can work in and be employed in? Like I know there's small animal and then
Yeah, so really the options are quite expansive. It's a very versatile degree because you can work in small animal general practice, or you can work in equine or large animal food production. You can do mixed practice, and that's just within a general practice space. There's in-home vet care, like a mobile service. You can do sort of a subspecialty within that space. If you want to do in-home euthanasia and palliative care, there's practices that just do that. There's a practice in Burlington that is strictly physio and rehab. but you can go through to be a specialist, or work in academia and research, either clinical research or, a friend of mine did epidemiology on veterinary mental health.
Oh, wow.
And then, you've got options in regulatory and food safety and import export and emerging and foreign animal diseases, zoonotic disease, public health. Working in industry, you can go work for the drug companies and become almost like a pseudo specialist in that particular product and organ system, supporting vets that are in clinical practice. So, like a lot of people that apply to vet school, we all love animals. Not everybody's a people person. There is a lot of people to work with as in practice. So if you want to focus more on the medicine without being peoply, there's industry, there's regulatory, where you're dealing more with this other specialists in the field as opposed to the general public, and that does have a different layer of type of people. Or even in wildlife rehab and shelter medicine, there's so many options that even when I talk to my colleagues and I listen, I haven't run into a classmate in a few years, getting their sort of career paths, and I'm always amazed at how many things they've moved into. One of my classmates went on and he did clinical practice for a while, and then he ended up creating one of the most popular AI programs for medical records in the veterinary field. So you have these different science and engineering and technology backgrounds, and another classmate ended up running the teaching hospital because they came in with management degrees. So it's really whatever you want it to be.
Yeah. Are there certain specialties or fields that are more competitive? I would imagine that the more specific and niche ones would kind of.
So certain niche ones are competitive simply because they're so limited. Things like zoo medicine is very popular, but obviously extremely limited. Surgery, of course, is very popular. Everybody loves surgery, but there's lots of options, and there's options within private practice. So larger hospital facilities are taking on residencies, so you can do them in private practice as opposed to just in academia. But depending how new the program is, you don't necessarily know all of their outcomes from those residencies. How prepared are you for those board exams compared to a longer standing residency training program? But yeah, so I think it's again widely variable in how prepared you are to travel for that extra training. Of course, if you really want surgery but you only want one spot, you're not prepared to move. That's going to be a lot harder than if you're willing to move anywhere across North America, pick up and go.
Yeah, that makes sense. So what does a typical kind of work day look like for you?
So there's very little that I can rely on in my schedule, to be honest. On my preferred days, I'm doing dentistry or surgery in the morning and appointments in the afternoon. Some days I will be on appointments all day and somebody else is having a turn in surgery or dentistry. But that's about as predictable as it gets, because we could have emergencies walk in at any time, or we could have, annual checkup and vaccines, and then a euthanasia, and then an ear infection, and then a dog that's been vomiting for a month, or who knows what else in between. Or cat, or I like to see small pocket pets as well, so rabbits and guinea pigs and hamsters and all that. So sometimes those are coming in, and it's always a bit of a surprise.
I mean, at least it's not boring. There's definitely variety.
Very rarely boring. And it's quite busy lately, that sometimes a quiet day that is a little bit boring is just fine, because I can catch up on all those things that I haven't had time to focus on, that should be done, or doing some journal reading or what have you. So it's widely variable and unpredictable.
How many hours a week do most vets typically work?
Again, that's widely variable. I mean, I do 3 days a week, and they're long days, so it's about 30 hours a week. Full time, generally 35 to 40 hours a week. But you can basically set your own schedule depending what you want or need, and how flexible you are with where you work. Like if you only have 1 day a week, you can work part-time. You can take part-time jobs, or you can't do weekends. Okay, find a clinic that isn't open weekends or doesn't need somebody to work weekends. Or if you want to do mobile service 10 till 2 on 3 days a week, you can make your mobile service do that. Is somebody going to hire you to do that? Maybe not. But you have all the flexibility in the world if you're willing to take it on yourself, and just set up a smaller practice. And if you have 6 hours a week, run a 6-hour online consulting service. There's online like virtual vet services. A lot of vets in GP are going to work full-time hours, but that's not that you have to. It's just how many other resources can you put into making the job and the schedule that you want. Are you going to get exactly what you want at the exact clinic that you want? Not necessarily.
So does that mean that the work-life balance is pretty good, or because you have control over your hours?
It can be. It can be. I would say if you are taking on an associate position, full-time hours, you want to stay at this clinic, they may not be open to you working there part-time. And they very well may expect you to do 10-hour days and miss your kid's bedtime and what have you. So it's very clinic and colleague dependent. And I think there is an increase in awareness and willingness to be flexible in that work-life balance, because the industry is largely female now. When, my boss is retiring, he graduated in the 80s. It was a very male-dominated profession for a long time. When I graduated in 2009, there were 12 men in my class of 110. And so you are seeing a huge female-centric, especially in small animal GP, workforce, that you have to be more flexible. Is everybody? No. Do they have to be as practice owners? No. But you're largely going to be replacing one female employee with another, so the industry kind of is having to evolve into that.
Yeah, yeah. You mentioned this a little bit, but there's a huge people aspect to being a vet, especially in general practice. So how do you kind of manage being a professional for your patients, but then also communicating with families and kind of being a support system for them?
Yeah, I mean, at the end of the day, unless you are working in some of those more niche areas like shelter medicine or a non-client facing sort of sector, all of the animals come with people attached to them. And people are amazing. Like the connections that I have with some of my clients, it's wonderful, and they become almost like family too. But it is a balancing act between, advocating for the pet and supporting them through those options and decisions, because a lot of decisions unfortunately do get made based on finances, and so it's tricky. And sometimes there are cases where you could help them, but for various reasons you can't. And it's hard on everybody. It's hard on the family, it's hard on the staff. There are communication courses in vet programs in a lot of the vet schools now to help you with that. Some of it is learning about yourself in the process, in terms of where your boundaries are and what you know you can handle and what you need to step away from, and just say, this is not a case that I can help you with. So it's a balancing act for sure. I think it's important to remember that your role is to advocate for the pet, but also you can't care more than the owners, and sometimes developing a little bit of a tougher skin helps you get there, but that comes with experience. Knowing where your boundaries are and knowing that you can't care more than the owner is a hard lesson to learn, but it does help you maintain that clinical detachment that helps you with some of those harder cases.
I would say most, if not like all people that become vets, like love animals.
Yes.
And that's such a big part of the reason that they went into that. So I feel like seeing sick animals and having to kind of stay like emotionally detached is probably so difficult. So
It's not necessarily that we have to stay completely detached, right? Like, you have a family that you've often known for 10 or 15 years, and this pet, or clients maybe longer. Like, we have clients that have been at our practice since my boss started, like 40-year clients. We've seen the highs and lows, the puppies, the end of it. You're gonna get upset when they're sick, when they are at their end of life. But I think there's also something special in that. It's a privilege that we have. I'm going to get teary talking about this happy stuff, but also the ability to end suffering, I think, is really important. That if we can't fix it for whatever reason, there is that option, because there are far worse things than death. Nobody wants to think of death as an option, and it's a crappy one, but there are far worse things. So a lot of the times that is the right decision, and I sleep fine knowing that in most cases. But also, like, we're there to help. We're there to help, and we're there to try and heal. And so while it sucks seeing these pets in pain, we have pain medication. We have things we can do to help, to fix, to heal. So in those instances, it's like a puzzle. But then owner factors and people factors and other things sometimes make it a bigger puzzle.
yeah, like there's a lot that you have to take into account. Like it's not just your professional opinion.
Yeah, and a lot of the times it is more a conversation and say, here's the options, but here's the factors that you're telling me about. So how can we optimize for everybody where we still get good pet outcomes and we still meet your requirements, and trying to work with the client rather than just making a decision of here's how we need to deal with this, because somebody has to pay for the bill, and it's a balancing act, and I think a challenging one that we don't think about in the human medicine side, because we are very fortunate to live in Ontario where 98% of our medical care is covered.
Yeah, yeah. This is like a really, really niche question. So I'm not sure how much detail you're going to go into, but I just found it really interesting. But
Probably too.
like one major difference between animal medicine and human medicine is that humans can tell you what's hurting, what happened, like their thoughts. Well, obviously animals can't do that. So how do you kind of approach diagnosing or studying animals when you're relying on things that their owners have told you?
That is an excellent question, and it really is the art of veterinary medicine is taking pieces of the medical history from the owner, which is more or less reliable depending who you're talking to. Sometimes you get wildly variable stories, or changing stories, or conflicting stories if you have multiple owners that come at the same time and they'll sit there and argue over what and when things happened. It's great. But you tie that in with the symptoms that are more measurable, simple. So things like they vomited or they peed here, or what, I changed this last week. Along with your physical exam, your physiologic parameters and responses can tell you a lot. It's not having practiced as a pediatrician. I figure it's a lot more like, working with neonates and pediatrics where they can't tell you these things. You can still pull out a shocking amount of information when they can't tell you things. But sometimes it comes down to, I'm not sure if they're painful. They're not helping me localize it, but there's something not right here. Let's do a pain medication trial. I would much rather they be a little bit sedated by this medication to test it rather than miss that they're in pain. But they're very subtle things, and there's all kinds of scales for assessing pain in different species. You get like the feline grimace scale for assessing pain to make it more like trackable and consistent among staff. But yeah, I mean your physiologic parameters, or a big one that I see is dental disease and dental pain. And unless, if somebody just clocked them in the face with a baseball bat because they were hitting a ball that the dog was then going to chase, and they jump up and they take the bat in the face, they just broke a tooth, then you see physiologic parameter changes. But if they've had this slow onset progressive periodontal disease, they'll have a trench mouth where all of their teeth are falling out. Their heart rate's not up because they've had time to adapt to it. But I guarantee you that mouth is sore. So it's a lot of experience. Sometimes it's trying pain meds. It's pulling information from all kinds of places to pull it together and make an assessment. And sometimes it's wrong because you don't have all of that information, but that's where you start running more tests, or I would rather try a test dose of pain medication, make sure we aren't missing it.
Is there anything that you find like difficult or that you don't like about veterinary medicine? Like, I'm sure that there's so many positives and things that you like love, but if there's anything that's like really challenging or difficult.
The hardest part about my job is the people. And the variable from one clinic to the next, and which clients you see that day, and which staff you're working with. Sometimes it's staff and clinic dynamics. Sometimes it's client expectations. Sometimes it's just a crummy case that is miscommunicated, or emotional responses are mishandled, misdirected.
Yeah. There's like a lot of
the people.
Yeah.
Early in your career, it's a lot of, figuring out what you know and being comfortable with it, and learning to be comfortable with what you don't know, because you know a lot of things. You don't have your sort of established protocols, and you almost have like an internal flow chart of like, if this then that, if this then that, and it kind of leads you down, and that process gets faster. So early in your career, it's a lot of, getting comfortable with what you don't know, being comfortable with being uncomfortable, and knowing that you know where to go find those answers. It's a balancing act while also managing the people, but now it's the people.
Yeah. Because I mean, you're not just dealing with like their pets, you're also dealing with communicating with them, and that's like a whole other aspect to it. So
I mean, there's a veterinarian who is a comedian. Well, there's a few of those, but there's one that was going viral for a little while there, and he did a bit about how during COVID we were doing curbside. Mommy. Basically, bring your dog up to the drive-thru, tie your credit card to them, fix them, and then hand them back with their dog and a bill. And for a lot of people, that would be just so much easier. I think there is a great part of practice is also getting to know the clients and the families, and helping them through these hard times when their pets and their babies are sick. And so it's an extension of that life cycle that makes it special too.
Especially if it's a really long-term relationship, I'm sure. And if you've seen like their pet grow up, and if you've seen like them get older, I'm sure. So yeah. This is kind of my last question, but to kind of wrap up, if you could go back and give your younger self any advice, or like even any high school people that are thinking of becoming vets, what would it be?
Get as variable experience in the industry as you can. It is great to get really in-depth experience. For example, I had years of experience in small animal GP, but there's so much more to the industry, even just moving within species or moving to different species. But if you can find different aspects, work for a specialist, work at the track, or do a couple weeks volunteering or working for a dairy farm or a food animal vet, or go do a placement at a university summer program or working student position. Take a summer job with the regulatory body and understand the regulations of the industry. There's so many different facets of veterinary medicine that you're not just limited to that. Know that there are different aspects within the industry, then changing your role within the field is not as scary. And you know that if one thing doesn't work out, it's still so flexible. My first job out was not the right fit. And instead of saying, let's try something else, maybe it's the job that's not the right fit, I was questioning whether I should be a vet. Did I go through school to find out that I actually hate this? I didn't quit. I moved jobs, and actually I love what I do. And I still love what I do. And that's with a lot of different experience before school. So I think it's finding... You find yourself along the way, too.
What experiences would you recommend if someone wanted to explore the field? Like before applying to university and things. Is it volunteering or shadowing? What would you kind of expect them to do?
Yeah, a bit of everything. I mean, not everybody has a vehicle to get out of the city to go volunteer for a week on a dairy farm, but maybe somebody's willing to host you for a week if they can provide accommodations. If you can't get a job in a vet clinic, go be a dog walker. Start a pet sitting business. Find ways to immerse yourself in different summer jobs over a few different years so that you see how different clinics work. Meet different aspects and different people within the industry however you can. I never thought of this at the time, but can you go to some of the conferences? Depends if they're open to non-vets. So I had classmates that started out as veterinary technicians too. Just there are ways, yeah. And just keep working, keep asking around, keep volunteering for a hobby farm or an alpaca farm or wool farmers. You know, like there's so many different ways that animals are involved in our lives and our manufacturing process and our food supply, not just dogs and cats.
Yeah, for sure. Well, your responses were so helpful and so insightful. I definitely learned about a lot about the industry, a lot about vets. So thank you so much for taking the time to talk to me.